Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Union Health Ministry asks state governments to emulate the best practices in various districts to tackle COVID pandemic. Centre issues advisory to states and union territories to protect vulnerable sections of society affected by the pandemic. Army Chief General Manoj Naravane reviews operational readiness and security situation in the northeast. And Countrywide Ayush COVID-19 counselling helpline on toll-free number 14443 operationalised. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with a second dose at a scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. Union Health Ministry has asked state governments to emulate the best practices shared by various district and field officials to effectively tackle COVID pandemic. In a letter written by Union Health Secretary Rajesh Bhushan to all the state health secretaries, he has suggested them to replicate the innovative practices by customizing them to the local needs. Prime Minister Narendra Modi interacted with the district and field officials of nearly 20 states and union territories on Tuesday and Thursday and discussed in detail the innovative strategies adopted by them to effectively manage COVID-related issues in their area. He had also asked them to share the best practices to the Central Health Ministry so that these innovative ideas can be further adopted by more states and districts. The Centre has issued an advisory to states and union territories to take immediate steps for the protection of vulnerable sections of society, including women, senior citizens and children who have been orphaned due to COVID-19 pandemic. In its advisory, the Home Ministry said several states and UTs have initiated action and strengthened their machineries to support vulnerable groups, and various success stories and best practices are now available where emergency services have been provided to the vulnerable groups impacted by COVID-19. However, in order to meet the new challenges arising out of the recent wave of COVID-19, the Ministry has urged to undertake an immediate review of the existing facilities for vulnerable groups, especially for children who have been orphaned, senior citizens who may require timely assistance, and members of SC and ST communities who may need guidance to access government support facilities. It is asked that the review may include steps taken for sensitization of police personnel, coordination with agencies and departments concerned, as well as communities and civil society organizations. National Commission for Protection of Child Rights, NCPCR, has stressed that centre and states should ramp up their preparations to protect children and neonatals as the third wave of COVID-19 is projected to hit the country. In a letter to Union Health Secretary Rajesh Bhushan, NCPCR Chief Priyank Gungungo has emphasized the importance to reorganize the National Emergency Transport Service and requested to issue necessary directions for the service and ambulances to prepare specifically for neonatals and children. Kanungo asked the Health Ministry to apprise the Commission if additional protocols or guidelines have been developed by ICMR for prevention and clinical management of children. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Army Chief General Manoj Naravane reviewed operational readiness and security situation in the northeast. General Naravane arrived at Dimapur yesterday on a two-day visit to review the operational readiness along the northern borders of Arunachal Pradesh and security situation in the hinterland of the northeast. The Army Chief was briefed by Lieutenant General Johnson Matthew, General Officer commanding Sphere Corps, and the division commanders on the prevailing situation and the operational preparedness along the northern borders. He complimented all ranks for maintaining excellent vigil and exhorted them to stay and keep watch on activities along the line of actual control. A countrywide Ayush COVID-19 counselling helpline has been operationalised. The toll-free number is 14443. The helpline is operational pan-India from 6 a.m. to 12 midnight on all 7 days of a week. Through the helpline 14443, experts from different streams of Ayush, namely Ayurveda, homeopathy, yoga, naturopathy, Unani and Siddha, would be available to address queries on the general masses. These experts would not only be providing counselling and feasible remedies to the patients, but would also guide them about the availability of nearby Ayush facilities. The experts would also be suggesting post-COVID-19 rehabilitation and management approaches to the patients. The helpline is IVR, Interactive Voice Response, equipped and currently available in Hindi and English languages. The helpline will initially take 100 calls simultaneously, and the capacity would be increased in future as per requirements. Through the helpline, the Ministry of Ayush aims to contribute to the community-wide effort to limit the spread of COVID-19. The effort is supported by the NGO project Step 1. AIMS Director Randeep Guleria has rebuffed certain claims made in few reports being circulated across different media platforms that black fungus or mucormycosis is caused due to consumption of raw food. Clarifying further on this, Dr. Guleria said the assumptions in these speculated reports are unfounded. He also rebuffed claims which suggest that mucormycosis is linked with the quality of medical oxygen given to the patients in healthcare facilities. Dr. Guleria added that the disease is also being witnessed in patients under home isolation who have not been given medical oxygen. Defense Research and Development Organization DRDO has developed an antibody detection-based kit, DIPCOVAN, the DIPAS VDX COVID-19 IgG antibody microvel ELISA for sero surveillance. The kit will be very useful for understanding COVID-19 epidemiology and assessing an individual's previous SARS-CoV-2 exposure. The kit can detect both spike as well as nucleocapsid proteins and SARS-CoV-2 virus with the highest sensitivity of 97% and specificity of 99%. The Defense Ministry said the kit has been developed in association with Vanguard Diagnostics Private Limited, a development and manufacturing diagnostics company based at New Delhi. The company will commercially launch the product during the first week of next month. It requires just 75 minutes to conduct a test without any cross-reactivity with other diseases. The kit has a shelf life of 18 months and it is expected to be available at about 75 rupees per test. A ceasefire came into force in Gaza Strip, bringing a halt to the fiercest fighting between Israel and Hamas. The Egypt-brokered ceasefire began early this morning, ending the 11th-day fighting. The Security Cabinet of Israel had approved a ceasefire in the Gaza Strip, bringing a potentially dangerous halt to the most aggressive fight in decades. The Cabinet said it had voted unanimously in favor of a mutual and unconditional truce proposed by mediator Egypt. The development came a day after U.S. President Joe Biden urged Israeli Prime Minister Benjamin Netanyahu to seek de-escalation and amid mediation bids by Egypt, Qatar, and the United Nations. A Hamas official told media that a ceasefire would be mutual and simultaneous. Palestinians poured onto the streets of Gaza soon after the truce began. Both Israel and Hamas have claimed a victory in the conflict. And now 20 News, here are the main points again. Union Health Ministry asks state governments to emulate best practices in various districts to tackle COVID pandemic. Centre issues advisory to states and union territories to protect vulnerable sections of society affected by the pandemic. Army Chief General Manoj Naravane reviews operational readiness and security situation in the Northeast. And Countrywide Ayush COVID-19 counselling helpline on toll-free number 14443 operationalised. That is all we have in this evening news bulletin. Good night.